30 days of walking. What changes first? What if one of the simplest movements your body can perform could begin changing your heart, your blood sugar, your brain, and your energy within minutes? Walking looks ordinary, but the moment your feet start moving, your muscles demand more fuel. Your heart begins pumping faster, and your brain receives a new flow of signals from the body. Keep repeating that walk every day, and those temporary changes may slowly become something bigger. After 1 week, the same route may feel easier. After 2 weeks, your sleep and energy may begin to feel different. And after 30 days, your body may handle daily movement in a completely different way. But walking is also surrounded by exaggerated promises. It will not melt belly fat overnight. And 10,000 steps is not a magic number for everyone. So what really changes inside your body when you walk every day for 30 days? And which results are actually supported by science? Let's begin with the first 10 minutes, because the changes start sooner than most people realize. First 10 minutes of walking, your body wakes up. The moment you start walking, your muscles begin asking for more energy. To meet that demand, your heart rate rises, your breathing becomes deeper, and more blood is directed toward the muscles in your legs. Oxygen and nutrients are delivered more quickly, while carbon dioxide and other waste products are carried away. Your ankles, knees, and hips begin moving through a wider range than they did while you were sitting. Your body temperature may rise slightly, and your nervous system becomes more alert. The faster the pace, the greater the demand. But a walk does not need to leave you exhausted to matter. At a moderate pace, your breathing becomes noticeably faster, but you can usually still speak in complete sentences. Even a short walk after hours of sitting can feel like taking the body out of standby mode. One walk will not transform your health, but it sends a clear signal. Your muscles, heart, lungs, and nervous system are needed again. Walking after a meal. What happens to blood sugar? After you eat carbohydrates, much of that food is broken down into glucose. Glucose enters the bloodstream, and insulin helps move it into cells where it can be used or stored. If you remain completely still, your muscles require relatively little fuel. But when you begin walking, those muscles become active and start using more energy. This can help reduce the size of the rise in blood glucose after a meal. Research suggests that walking soon after eating can improve the immediate glucose response, although the size of the effect varies between people. It does not erase the meal, cure diabetes, or replace medication. But it shows something important. Movement changes what the body does with incoming fuel. Your legs are no longer passive tissue. They become active consumers of energy. For many people, a brief walk after eating may be an easy way to break up sitting time. But anyone using insulin or glucose-lowering medication should be careful, because exercise can sometimes lower blood sugar more than expected. First week of walking. Your heart begins to adapt. During the first week, the hardest part may not be the walking itself. It may be repeating it every day. One day the weather is good. The next day you feel busy. Your legs may feel mildly sore, or your usual routine may pull you back toward the chair. But each walk gives your cardiovascular system another small training signal. Your heart pumps more blood. Your blood vessels respond to the increased flow. Your muscles repeatedly request oxygen. At first, the same route may make you breathe heavily. Several walks later, it may feel slightly easier. You may recover more quickly after a hill, or notice that your breathing settles sooner when you stop. These changes are not dramatic, and they may not be visible in the mirror, but they matter. The body adapts to repeated demand. If it repeatedly experiences inactivity, it becomes accustomed to inactivity. If it repeatedly experiences movement, it begins preparing itself to move more efficiently. Walking and your brain. Mood, stress, and focus. Walking happens in the legs, but the experience reaches the brain. Movement increases sensory signals from the body. Your eyes take in a changing environment. Your arms swing rhythmically. Your breathing becomes more regular. And for some people, this combination creates a mental shift. A walk may interrupt repetitive thoughts, reduce the feeling of being trapped at a desk, or make it easier to think through a problem. Regular walking has been associated with improvements in symptoms of anxiety and depression, although it should not be presented as a cure or a replacement for professional care. The environment may strengthen the effect. Walking outside can add daylight, fresh air, and distance from screens. By the end of the first week, the change may be subtle. You may feel slightly calmer after work, more focused when you return, or less mentally restless at night. Sometimes the brain does not need another hour of stimulation. It needs rhythm, movement, and a change of scene. After 2 weeks of walking, sleep may begin to change. By the second week, the daily walk may begin feeling less like an interruption and more like part of your routine. Your muscles know the movement. Your breathing feels more predictable. And some people may begin noticing changes in sleep. Regular physical activity is associated with better sleep quality, though walking alone cannot correct every sleep problem. Sleep is also influenced by stress, caffeine, light exposure, noise, medical conditions, and the time you go to bed. But movement can help strengthen the contrast between activity during the day and recovery at night. A gentle evening walk may help one person relax, while another person may prefer walking earlier. Daytime energy may also begin to feel different. This seems strange because walking uses energy, but repeated activity can improve stamina. The same stairs, errands, and daily tasks may require less effort than before. You are spending energy to train a system that may gradually become better at producing and using it. After 3 weeks of walking, muscles and joints adapt. After several weeks, the muscles of your calves, thighs, hips, and core have repeated the same movement thousands of times. They may not become dramatically larger, but their endurance can improve. Your feet and ankles also become more familiar with supporting your body over distance. For some people, regular walking can reduce stiffness and make daily movement feel easier. But low impact does not mean zero impact. Sudden increases in distance, poor footwear, hard surfaces, and old injuries can irritate the feet, knees, hips, or lower back. Pain is not proof that the walk is working. A gradual increase is usually more sustainable than trying to double your distance overnight. The goal is not to survive one exhausting session. It is to choose a level your body can recover from and repeat. Walking can support muscles, bones, balance, and joint function, but it does not replace all forms of exercise. Strength training and balance work provide benefits that walking alone may not fully provide. Walking every day. Does it burn body fat? Walking requires energy. If you walk regularly, your total daily energy expenditure may increase. Over time, that can support weight management, especially when combined with an appropriate diet, sufficient sleep, and other activities. But walking cannot choose where fat is removed from the body. It does not specifically melt belly fat, and 30 days does not guarantee a dramatic transformation. The result depends on your body size, pace, distance, food intake, starting fitness level, and whether you compensate by eating more or moving less during the rest of the day. Someone who was almost completely inactive may notice a larger early change than someone who was already walking regularly. The number on the scale may fall, remain stable, or even fluctuate because of water, food, and other factors. But the scale is not the only result. You may walk farther, breathe more comfortably, recover faster, or feel more willing to move throughout the day. Walking is powerful, not because it promises a rapid transformation, but because it is simple enough to repeat. "10,000 steps. How much walking do you need?" 10,000 steps is popular, but it is not a biological requirement written into the human body. There is no single perfect number for every age, health condition, and starting level. For someone who currently walks 2,000 steps a day, moving toward 4,000 or 5,000 may be meaningful progress. General guidelines recommend that adults aim for at least 150 minutes of moderate intensity aerobic activity per week, such as brisk walking, with additional benefits possible at higher amounts. That could look like 30 minutes on 5 days, but it does not have to be completed all at once. Shorter walks can be added together. The talk test is a useful guide. During moderate activity, you can speak, but singing would be difficult. A relaxed walk still adds movement, while a brisker walk creates a stronger cardiovascular challenge. The best target is not the number that looks impressive on a screen. It is the amount you can build towards safely and continue consistently. 30 days of walking. The real results. So what really happens after walking every day for 1 month? Within minutes of each walk, your heart rate, breathing, circulation, and muscle activity increase. After meals, walking may help your muscles use some of the glucose entering the bloodstream. Over repeated days, the same route may feel easier. Over several weeks, some people may notice better stamina, mood, sleep, concentration, or daily energy. Regular physical activity can support cardiovascular health, blood sugar control, weight management, muscles, bones, and mental well-being. But 30 days is a beginning, not a finish line. You may not look completely different. You may not lose a dramatic amount of weight. And walking through severe pain is not a sign of discipline. The most important change may be quieter. Movement begins to feel normal. The body starts expecting the walk instead of resisting it. This video is for educational purposes only. It does not provide medical advice. If walking causes chest pain, faintness, severe shortness of breath, or significant joint pain, stop and seek appropriate medical guidance. 1 step looks insignificant, but repeated day after day, steps become distance. Distance becomes adaptation, and adaptation becomes a different way of living inside your body. Subscribe to Inside the Human and keep exploring the science of body, mind, and life.